Debbie Seidel-Bicky, and during the month of May, I'm going to walk you through some time management principles. I've called them the 4Ds. And this week, we're going to cover data collection. Data collection should last about 10 to 15 minutes. And let me show you now what you'll do during data collection. This week, I'm talking about data collection, and this is just an example that I put together for you, and there's a template that you can email me to create your own blank slate and your own time limitations for treating your patients. This is just an example that I put together so you're not just sitting at every patient and not having a time frame to work within. For your typical hygiene patient, you're going to provide these types of procedures during data control. And the review of medical history, occasionally, probably every 2 years, you want to have a patient complete a new medical history. And when you know that time is coming up, ask the patient to come in 5 or 10 minutes early. Many offices use electronic charts in today's world of dentistry. And there's also an iPad check-in, and the patients can complete some of these things. For example, the review of medical history and the smile analysis can be completed ahead of time if you ask your patient to come in early. They complete it on the iPad, and that streamlines into your electronic patient chart. So as you see, I've outlined this. For example, the review of medical history should take maybe 1 or 2 minutes when you know that patient well. The blood pressure, if you're using just that simple wrist cuff, it's going to take 1 or 2 minutes max. And the smile analysis, just once a year, maybe 2 minutes. Some of you are using Visalite, Velscope, some of these oral cancer technologies. That might take 4 or 5 minutes. But every time the patient comes in, you are going to provide some type of oral cancer screening, whether it's just feeling, palpating, that sort of thing. X-rays, maybe you're doing those just once a year, and you'll schedule those so they alternate with your full periodontal screening exam. So you're going to coordinate those so you're not doing your x-rays on the same appointment that you're doing your periodontal exam. And each time you'll do a restorative exam. You're examining for decay. You're seeing, does that patient have previous restorations that are uncompleted. So let me walk you through. This is an example that I put together. It's Carly Curry. She's 30 years old, and she's a healthy patient coming in for a prophylaxis. Some of you are seeing these types of patients throughout the day. 2, 4, 6 of these types of patients come in. So you're reviewing the medical history. Takes a few minutes. Now today, on this appointment, she did not get her blood pressure taken, but we did a smile analysis. She completed it at the front desk when she checked in with the iPad. Now I'm the hygienist, and she's seated in front of me, and I'm just quickly discussing, is she unhappy with discoloration of her teeth or some spaces? I'm just going to do a 1-minute palpation for the oral cancer screening. She is going to get a full mouth periodontal screening exam where I'm measuring all 6 points, doing recession, furcation, mobility. I'm checking those areas, but basically Carly is a healthy patient. However, the way you can expedite this perio exam is during your team huddle. The hygienist is prepared and understands what's going on with her or his patients. So when it's time for the hygiene department to report on their patients in the morning huddle, the hygienist is going to report that they are doing a periodontal exam on Carly Curry. And say, for example, Carly Curry's coming in at 10 o'clock that morning. So we know that at 5 minutes into that appointment, somebody has already said they're going to show up in the hygiene room. It's maybe one of the assistants. It could be one of the auxiliaries at the front desk that during that team huddle said, I'll be there to do your periodontal exam. So now that auxiliary shows up in the hygiene room at about 5 minutes into the hygiene appointment, and they are there present to just type in all the numbers and areas of bleeding points, etc., that the hygienist is calling out. Carly Curry has a healthy mouth. So the restorative exam might not even take 3 minutes, but it's a look around Carly's mouth to see if there are new areas of decay, and perhaps she has some untreated areas of decay, and we're going to talk about those, and that we're going to get those scheduled today. Now, Carly Curry is going to come back in 6 months, and when she comes back, we know that we're going to review that health history again. If we know that Carly Curry needs a new medical history, we're going to ask Carly at this appointment now in May that when she comes back in November, she's going to come in 5 or 10 minutes early. And when Carly comes in for her next hygiene appointment, I'm planning to do a blood pressure screening, and I know it's going to take no more than 2 minutes. I'm also going to use my Visalite at that appointment, about 4 minutes, and x-rays. We're going to take x-rays. We have digital x-rays. They're 4 bite wings. It doesn't take me a lot of time to do that. And I'm only going to spot probe at that point in time. Carly's always had a healthy mouth, never anything over 4 millimeters. That doesn't take very long to do. And again, my restorative exam. So you can see that we've created a down to a science for the time management. I want you to remember that this is something that I've designed, and you can actually format your own time so that you have a down to a science protocol for your hygiene patients.
Well, I sure hope this training today has been helpful for your dental practice, especially the dental hygienist, and you can feel like you're not running on a treadmill, but relax during that appointment and enjoy your patient time. Next week, I'll be back to talk about determination of your treatment, and so be sure to tune in either through my YouTube channel or the blog.